Good afternoon, everyone. Thanks so much for being here today. I wanted to, my presentation today is called Understanding Civic Health, How to Measure It, Why It Matters, and How It Can Transform Democracy. And as a bit about me, I'm a civic health researcher. So what that means is I've written 2 civic health indexes in New Hampshire. We're about to write our 3rd right now, which is a pandemic edition to see how civic health has changed because of the pandemic. I'm also working to write the first civic health index in Maine, and we'll be helping Florida to write their civic health index for 2024, so that's really exciting news. I coach local government, nonprofits, and universities about civic engagement best practices, and I also run my own consulting firm called Public Engagement Partners, and then I'm a faculty fellow at a few different places. I actually wanted to point out, in addition to my sort of professional photo here, I do have a photo of myself volunteering. This is on a Habitat for Humanity trip in Romania. And I think it's really important to share that because, you know, even though we're professionals, we also have identities in our community, and we wear lots of hats. And so I'm just hoping to sort of make those spaces less separate, and that's why I included that photo. So I will go to the next slide here, which is actually, I'm going to ask you to do something. So Dean, if you don't mind cueing the poll, that would be great. And I'd love for you to just participate in a Mentimeter poll. If you haven't used Menti before, it's just a fun online polling technology. So you go to menti.com and then enter this code. Let me know if anyone's having trouble accessing it, and then we'll see the results of this poll. But this is just a way to get us warmed up today, thinking about civic health. Can we go, do we need to go back to the code? Do people still need it? Oh, okay, it's on top as well. We can hover here for a second, that's okay. Are people able to get in and access the questions? Yeah, good.
So there may be a issue phone versus wireless system. So I'm not using Menti.
Okay. It's not coming up. Okay, so it looks like only some people's phones are working here. Yeah, sorry about that. So this may not work for everyone, but it does look like some folks are able to get into the poll, so we'll go with what we have. But what I wanted to, the question here, and I know the font's a little small, so I'll read these categories, but the question here is what civic challenges are you noticing in your local community? So, you know, what's interesting here is I'm seeing a lot of lack of trust in public institutions, government, police, and schools. Also seeing tensions between certain groups or people be really high. A few people are saying neighbors don't know each other, poor public meeting attendance. Some of you might want to respond to this and not be able to get your phones working, so sorry about that. But, you know, just to kind of share the other categories here, there's a few places to come together, lack of an interest in local issues, not enough volunteerism, and disillusionment about the present and the future. So I think, you know, I see all of these issues being challenges to civic life right now. So just wanted to kind of get us thinking about, you know, what you're seeing in your hometown, what you're seeing in your local community, and you can kind of pay attention to this and start observing. We can go to the next slide, just kind of a fun warm-up. And go past this. Oh wait, this is me now. Sorry. All right, so we did that. So I want to talk to you about why civic health matters. Obviously, you're all somewhat invested because you came to this conference today, but I want to ground us in some national facts about why civic health matters. So I always find this to be a really interesting statistic. This is from Pew. And basically, they interviewed Republicans and Democrats about what they agree on, and what they found is that the thing that Republicans and Democrats agree on is that they can't agree on anything. So we've got 81% of Republicans and 76% of Democrats polled saying that what they agree on is that they don't agree on anything. This is from a tool called the Belonging Barometer, a national measure of belonging. And what they found is that 74% of Americans reported that they don't feel they belong in their local community. And 68% felt like they don't belong in the nation, and 64% felt like they don't belong in their workplace. So this is really alarming stuff to see this. And a Cigna study, health provider, we're at a health equity conference, reported that more than half of adults report being lonely. And this is actually a data trend that was happening before the pandemic. So if you're thinking this is explained by the pandemic, I think this was exacerbated and made worse by the pandemic, but things were already trending in this direction. And what Cigna found is this is much more acute for underrepresented groups. So for people of color and for youth in particular, as you probably are familiar, there is a youth mental health crisis going on in this country right now. And I think a lot of it is connected to feeling like you don't belong in your community, like you're not welcome in your community. And so, this is really eye-opening kind of stuff. Another trend is that the census data is indicating that volunteerism actually is on the decline. From 2019 to 2021 dropped 7%, which is the biggest decrease since the census started measuring volunteerism in 2002. Now, maybe some of that's explained by the pandemic, but I think this is something that we really want to watch over time, right? What's going on with volunteerism? And then, I don't think it's any news to you that democracy is under some real threats right now, and this isn't just about the United States. This is a global issue. So this is a statistic, again, from Pew. Pew surveyed 27 countries that were democratic countries and found that 51% reported that they were not satisfied with the way democracy was working in their country. A related study is by an organization called Freedom House, and Freedom House has been tracking the progress of democracy and has seen declines in democracy for the past 17 years. And this gap is actually narrowing, where what they're seeing is that the countries who are improving civil liberties and political rights and those that are seeing declines in liberties and civil rights, that gap is really narrowing. So basically, we're seeing fewer and fewer countries get progress in liberties and political rights. So, it's concerning stuff. But let's bring it back to Florida here. So these are some headlines I pulled from national news articles or local news articles about Florida. And I'll just let you kind of let this wash over you for a second if you want to read these. I would say as Floridians, this is probably no surprise to you, some of this news. But what we're seeing is that Florida is an incredibly polarized state. There's a lot of threats to civic health going on in Florida right now, and I know that you're probably experiencing these on a daily basis. So understanding civic health and taking action around it, I think, is particularly important in this state. So I wanted to do some defining around civic health just to help us understand it a bit better. And I actually made a video with the University of New Hampshire's School of Public Policy defining civic health. So I thought I'd show you this video clip so you could hear it in some other people's words. Dean, thanks for cueing the video.
How do we foster a community where people are connected and where they trust and care about each other?
How do we build communities where people know they matter, where they show up at events, volunteer, stay informed, participate in important decisions, and vote?
We know the way our communities function is important. For instance, none of us enjoy going to a public meeting filled with yelling and angry disagreement. And if there is a community crisis, like damage from a bad storm or a tragedy, we want our neighbors to help each other, so we can navigate the hard times.
In communities where people are isolated from each other and the public is polarized, we want to know, what are the things underneath these trends? What could be discouraging people from participating in local civic life? And most importantly, what can we do about it?
At the University of New Hampshire's Carson School of Public Policy, we have been exploring how to collect important information about civic health for over a decade.
Civic health measures factors like how much people vote, stay informed about important issues, help neighbors, trust each other, volunteer, attend public meetings, and talk to people different from themselves.
We think this civic health information is helpful to support communities to thrive and for democracy to function effectively at the local level.
We often notice information in our communities about our schools, police, taxes, and the environment, but we don't always connect the dots to how this information connects to civic issues.
For instance, if we're experiencing high rates of students leaving school before they graduate high school, there may be other factors that explain this, including how much students feel they matter and how connected they feel to others in the community.
The Carsey School has collected information about civic health in New Hampshire since 2009. The most recent was issued in 2020. These indexes have allowed us to understand important trends in the state.
For instance, in the 2020 index, we learned that trust in local government has fallen, and that younger people in the state are not engaging in their communities as much as other generations. These insights help us then address civic issues in the state.
So that's just a little bit about civic health in other people's words, but I thought it would be helpful. So just to kind of break this down a bit more in terms of what is this thing called civic health that we're talking about this week, I would say that civic health is really three things: behaviors, beliefs, and actions that are related to civic engagement. And generally, I categorize civic health in these ways, but it can mean much more than what's on this list, but this is kind of a good baseline. So civic health is certainly about voting, but I think that a way that we get a little myopic around civic engagement sometimes is we think voting is the only measure of civic health in communities, and there's so much more to civic health than just voting, and we know that when we live in local communities, that voting is only one day, right? And civic health can be behaviors that are happening every day. So it's about volunteering in community service, helping out your neighbors, attending public meetings, staying informed and talking about issues, people believing they matter and can make an impact, people feeling that they belong and that they trust their public institutions, that they trust their neighbors. So that's kind of how I would define some of civic health, and I'm sure we'll be building on this concept today as we hear from other speakers. So civic health can really occur at different levels. So certainly we've got civic health at the national level, right? So we can look at what's going on with civic health in the U.S. in general right now. We can measure civic health at the state level, and you can also measure civic health in local counties and municipalities. And I think you can even measure civic health in smaller communities like a school or a university or an apartment building. But something that's really connected to civic health is a concept called civic infrastructure. So I wanted to explain that a little bit because it sounds a little bit heady when you hear it at first. So what I would say is I would think of civic health as an outcome that is facilitated by civic infrastructure. So if we think about physical infrastructure in our community, like a road or a bridge, basically civic infrastructure is the idea that, like a road or a bridge, if we don't maintain a bridge, then it's going to cause a lot of problems for our community, right? We suddenly can't get places, communities are cut off. In the same way, if we don't invest in civic infrastructure, our civic health outcomes will not be as strong. And this is a concept taken from the Stanford Social Innovation Review by some folks called Blair and Copel, if you want to read more about it. But basically the idea is that civic infrastructure and civic health are very connected to each other. So I wanted to just define this idea of civic infrastructure a little bit more because I think it'll help us in the conference this week. So what is civic infrastructure? So I'd categorize it a few different ways. So first, I'd say it's places and spaces for people to connect. Some of these are physical places, right, like a park, a public school, a library. But I think they can also be created spaces like cultural festivals, block parties, right, events to bring people together. The other important part about civic infrastructure is networks, right? So basically this is the idea of social capital. Do people know each other? Are they connected to each other? So this can be things like volunteers at a Rotary organization, a condo association, the PTA, black sororities and fraternities. But it can also be more grassroots groups that are just people who are concerned folks in their community getting together to try to come together to address an issue. Local leadership is also a big one, and I think it's something we're struggling with in this country right now. But for good civic infrastructure, I think you need local leaders that are collaborative with the public, that are transparent, who are accountable. And hand in hand with that goes local leaders who are passing laws and policies and practices that support healthy civic infrastructure. So some of these policies might be around things like civic education, more participatory governance or co-governance, and diversity, equity, and inclusion initiatives where people feel like they're welcomed and they belong. And the last piece about civic infrastructure that I would point out, which I think is starting to become pretty well understood and known in the civic engagement field, is just addressing barriers to engagement. So things like providing childcare at events, providing translation so that non-native English speakers can participate. I think we're starting to know that these are best practices, but when they don't exist, this is a deficit in civic infrastructure. So to kind of connect things, I created this civic continuum. And the way that I would describe it is that the quality of civic infrastructure facilitates strong or weak civic health outcomes. But then civic action can improve civic health. Civic health, when you start to learn about civic health, it can also prompt civic actions. So to just give an example of how this would work, let's say that in your civic infrastructure, it's rather hard for people to vote. And let's say it's particularly hard for maybe younger people to vote because there aren't things in place like same-day voter registration, right? And so we can imagine that youth might not necessarily know that they had to register in advance, right, if it's their first time voting. So then maybe we see, because of this civic infrastructure issue, that youth voting is low, right? So it's a civic health outcome issue now. Youth voting is low. So what do we do about that? Well, we could take civic action to create some kind of initiatives that better address how to support youth in voting. So maybe that's something like, I'll give an example. In New Hampshire, in one of the high schools, they actually call down seniors in the spring before they graduate and provide them with voter registration forms and say, now that you're 18 years old, if this is how you can register to vote, and they do it right in the school, right? So they just made it a school policy. So that's, imagine if that was happening in every high school in the country, for instance, right? So that's just an example of a civic action you could take to address a deficiency in civic health. You could also take civic action to improve infrastructure. So maybe you say, we just got to make voting easier in general. So we're going to set up voting booths on college campuses, or places where youth are often convening to just make it, simplify this issue. So I know this is all easier said than done, but I'm just giving an example of how all these different parts of the civic continuum connect with each other. So I've had the pleasure of dwelling in the space of trying to measure this thing called civic health for a number of years now, and I've been doing that in 3 different ways. So I wanted to talk about each of those today with you. One is the Civic Health Index. One is called Belonging and Engagement Landscape Analysis, or the short version is BELA. And then the last I just called Taking It Local, but it really connects to this local civic health guide that's in your packet. So you can kind of find that in the back of your packet. And I'll share more about that in a few minutes. So what is a Civic Health Index? So the National Conference on Citizenship, which is an organization based in DC that is connected to some congressional funding, they created the Civic Health Index in 2006. And basically, it's a report that pulls census data to help you understand civic health at the state level or in large metropolitan areas. Many states also draw on supplemental state data to write their civic health index. So just for instance, when I did this in New Hampshire, we used other reports that were related to civic engagement in the state that we just wanted to pull information from. And then we actually also ran our own original survey to just kind of deepen some understandings around civic health, because there were some things that the census measured that were really helpful, and there were some things that we felt were missing pieces. So we did an additional survey. So the Civic Health Index has now taken place in over 35 states and cities around the country. And I wanted to just show you some findings from the New Hampshire Civic Health Index so you could see how this would be relevant to Florida. And I will say, Florida has done a Civic Health Index before, but it's been a number of years. I think, was it 2012, Bob? Since 2011, since Florida has done a Civic Health Index. So it's well overdue to look at civic health again. I think a lot has happened since 2011, we can all agree. So these are some of the things that we found in New Hampshire. One thing that we found is that New Hampshire ranked 46 in connecting with people of a different racial, ethnic, or cultural background. So 46 out of 50 is not good, and it was really alarming to us in New Hampshire. But the reason I'm showing this is just to say that the Civic Health Index can be a comparison of how your state compares to the nation or to other states, basically. The other thing that we did in New Hampshire is collect some longitudinal data. So there had been a survey run in 2001 about trust in public institutions and trust in neighbors. So we actually ran that survey data again, and we were able to have essentially a 20-year snapshot. And you can see what we found here was really staggering. So this is trust in government declined across the board in New Hampshire from 2001 to 2019. But if you look at that orange line, trust declined by nearly half, right, over half, from a 20-year snapshot. So then it says to us, like, okay, so why is this happening? And you may all have different theories about that, right? But it's just an alarming statistic to look at. And the other thing, I know this might be a little harder to read for people, so I'll break it down, but another thing that we were able to do with the Civic Health Index is actually disaggregate different variables to try to understand like a little bit more about what these civic health outcomes mean. So here, we took different generations, so you see millennials, Gen X, baby boomers, and the silent and long generation. And basically we were able to look at how they did on different outcomes. So here you've got on the left local voting, engaging with news, contacting public officials, attending public meetings, and posting views online. And you can see the blue bar is the millennials. So you can see on almost every outcome, the millennials were behind other generations. So this is just, again, really helpful information for us as a state to understand, what's going on with civic health. But, I have experienced a few challenges with civic health, with the Civic Health Index, and I think it's a great tool that really can help us understand some big picture issues in a state or in a city, and so it's an incredibly valuable tool, and yet it doesn't tell the full story, and so that's why I started thinking about how can we supplement the Civic Health Index with some other measures to really understand what's going on in our communities. So one challenge that we found with the Civic Health Index is that you can't compare, it's pretty hard unless you have very large cities in your state, you can't compare different communities to each other. So, it would be difficult to compare St. Pete's to Miami to Tallahassee to like a smaller town or smaller communities within Florida. And we know, living in a state, that experiences are different around civic health in different parts of the state, right? So that was one challenge that I found sometimes. The other challenge is that survey data is just one data point in time, right? So it doesn't actually tell us, that was how people were feeling that day, right? So maybe that day they were feeling like they're pretty engaged with their neighbors, and then the next day a terrible thing happens and they never talk to their neighbors again. And we don't get to know that whole story from the survey. So really what that queued up for us is that there is a need for more depth of understanding about civic health issues, particularly around the experiences of underrepresented and vulnerable people in the community. So I created a tool with some of my colleagues, and it's a qualitative tool called Bella. And this is what I've been using alongside the Civic Health Index, and it's really focused on trying to hear stories around civic engagement in a given community, learn more about the history of engagement, what some of the local assets are, where the trends are in engagement, and where the challenges and barriers are. And so I've actually been doing this with Seattle. So this is a work in progress that I'm sort of sharing preliminary findings about. And in Seattle, basically, we worked with a design team of different community partners, and we came up with what we thought was the most important question to us around doing the Bella, which was, we knew that there was a narrative that civic engagement overall was strong in Seattle, but we wanted to know, is that true for underrepresented and vulnerable populations, or are they having a different experience around civic engagement in Seattle? So what we did is a qualitative analysis. So we interviewed a bunch of people in equity advocating organizations, We also talked with some people who had kind of a bird's eye view of civic life, like, a head of a community foundation or something, who could kind of comment on different dynamics they were seeing in the city. We conducted some focus groups and collected a bunch of documents, including local media coverage about civic engagement issues, also looking at other, like, different reports around civic engagement in the region, kind of trying to, like, inventory and bring together all of those ideas. And we found some different trends around what was going on in Seattle. And so we came up with 7 themes. I won't share all of them today, but one theme we came up with was that underrepresented groups have low levels of trust in public institutions. It's probably not going to surprise some of you that this was a finding, right? And so here's some of the things that we found. So we were hearing that there's low levels of trust in local government, police, schools, and healthcare institutions. But the issues were different for different populations. So for people with disabilities or parents who had children with disabilities, there was low trust in schools. For the LGBTQIA plus community, there was low trust in healthcare institutions as well as the police. For the BIPOC community, low trust in police. And for the Native American community, we found in a survey that large numbers of the Native American population were feeling like they just didn't belong in the region of Seattle. And so really the theme that came through when we were interviewing these organizations is that there was a desire for more compassion and recognition of some of the trauma of the past in terms of the civic dynamics in the city, so that the people were actually able to move forward. They first needed to acknowledge the past. And so this prompted for us a series of civic questions, and these are questions that cross-sector leaders in Seattle are going to be working through in the coming months. So I'll just kind of read these. What strategies for building trust? What are strategies for building trust that acknowledge and heal the past and move us towards a positive future? How do we balance pressures public institutions feel to produce and stick to timelines with community needs to move slowly and intentionally? What is the best way to help public institution leaders understand and respond to fears of different populations in the region? And what trainings or actions have been meaningful in building trust among underrepresented groups? So you can see here, this is just, having percentages is really helpful in some ways because it directs us to what the issue is at hand. But then a tool like this can help us uncover what is behind the issue. So as an example, the Civic Health Index might tell us we're having low turnout at public meetings. What the Bella can tell us is what's the story behind why people aren't showing up at public meetings. So I wanted to just direct you to a last tool. I was going to show a video about this, but I think I'm going to skip it actually. But I wanted to just direct you to this local civic health guide that some of you might find in your packets. So we developed this at the Carsey School. Let's see if there's another slide. Okay, I guess that's gone. We developed this basically to try to help support local communities in understanding their civic health at the local level. And so we have a couple tools, and I just wanted to kind of walk you through these if you want to thumb through the guide with me. So there's a lot in here, but just to kind of direct you to a few. So on page 13 of the guide, you'll see some flowers. And this is a community mapping activity. So it goes 13 through 15 if you just kind of flip through. But really, we created this because something that I've been finding is that the partners that I worked with were having a really hard time identifying who should we even have in the room. And there was a lot of desire to engage a more diverse cross-section of the community, but then they didn't know how to actually do that and make that happen. So we made an exercise around that. On page 23, there's an equity exercise where you can kind of work with a group to challenge some of your norms around how you're engaging the community and sort of push yourself to think more deeply about equity. On page 34, I know this is a little bit messy, but I thought it might be helpful to actually open up this guide. On page 34, we created a community dialogue that you could have around civic health. So you could modify this, but this is basically a discussion guide that you could use if you wanted to host a community dialogue about, what is the status of civic health in our local community. And then on page 39, we actually put together a survey bank. So I hear communities a lot want to run their own surveys on civic health, but if you're not an experienced survey researcher, it's really hard to know how to develop a good survey question and what kinds of questions to ask. So we actually pulled these questions. Some of these are from the census data, so the same data that the Civic Health Index is using, and some of them are from other tested instruments. But these are good quality questions to use to learn more about civic health in your community if you wanted to do a survey. So I will say we developed this for New Hampshire. So some of the stuff you'll see in is a little bit New Hampshire specific, but a lot of it is relatable to any context. And I think over time, the hope is that we're going to develop one of these specifically for Florida. So stay tuned. I think that's hopefully coming in the future. So I wanted to just close with a couple examples of how civic health can impact statewide action, because you might be thinking, all this data is cool, Quixada, but what does it do? So I wanted to show you a video from Connecticut. And before I show this video, just wanted to do a time check. Am I, I don't have a clock here. Am I doing okay on time? Yeah, okay, great. So I wanted to show you this video from Connecticut. In Connecticut, they actually, after they produced the Civic Health Index, the Secretary of State got involved in an initiative to create civic health ambassadors at the local level. And so they had civic health ambassadors in 40 different communities around the state. And this video shares a little bit with you about what they do.
We live in communities, these shared geographic spaces where we shop, work, play, eat, sleep, and learn. How these communities are shaped, how they function, how they work, all of these decisions are made locally and affect our lives much more immediately and much more profoundly than national decisions. All across Connecticut, people are coming together and getting involved, contributing new ideas and creating solutions that build diverse, vibrant, thriving communities. Building civic engagement, at its core, it's really the most important factor in making communities work.
Hi, my name is Jamie Bianca, and I am a senior at Trinity College in Hartford, Connecticut. I have been a Connecticut Civic Ambassador for about a year now. And I've been getting involved with community service ever since I was little. My brother is on the autism spectrum, so I really enjoyed working with organizations like Special Olympics and the Connecticut Challenger Leagues and Shepherd Meadows Therapeutic Riding Center to help children just like my brother. Being able to be involved in civic engagement is so important because what I realized is that it takes a team. And we all want to be leaders and we all want to take charge on certain projects. But it's really important that before we lead, we learn how to be a follower, and we learn from people who have had other experiences and allow them to share their stories. And that's really important because, as Congresswoman Ayanna Pressley said, the people closest to the pain should be closest to the power. So I always remember that with all of the work that I do.
My name is Rashamel Jones. I am the former University of Connecticut national champion. I am currently the director at the Orchid Boys Club and Girls Club of Bridgeport, Connecticut. I became a civic ambassador for a few reasons. One, myself, I've come from a broken marriage. I was raised by a single father, and as a youngster out in the world, young children need responsible adults to care for them, to love them, to encourage them, and to empower them. And along my way, there were people, coaches, basketball coaches in my life that gave me those tools, that encouraged me, empowered me, and strengthened me, and told me that I can become whatever I chose and whatever I put my mind to. And growing up, I was blessed to have special individuals, special people in my life, and that is the only reason that I became a civic ambassador, And this is the reason why I am currently the program director here at the Orchid Boys Club and Girls Club, is strictly to empower, encourage, and to give our youth love.
Oh, we can stop the video here. Thanks so much. So that gives you a sense of Connecticut. So I also wanted to share how we've used this work in New Hampshire. So I think if you remember back to that graph with the blue bars, we saw that millennials were not as engaged as other generations in civic health. So this ended up creating a lot of statewide buzz about this issue with local media outlets. So you can see some of the headlines here. And so there was a discourse around, like, what's underneath this issue around why younger generations aren't engaging as much. And what ended up happening was because of that, and partly because of that, I won't take full credit, but New Hampshire recently passed the first civic education bill in the country in recent years. So now civic education is actually required in every high school in New Hampshire, and students have to pass a civic education test to graduate. Now, is that the best way to handle civics education? We could kind of talk about that a different time. But the point is, the civic health outcomes did trigger legislation and policy in the state. So just really exciting to see that happen. And the last thing I wanted to point out is work in Wisconsin, because this is quite relevant to the conference here today. So the University of Wisconsin's Population Health Institute did this study, so you can read this article. It's in a publication called Governing. And basically what they found is that in communities where there's not as strong civic infrastructure, you're seeing poorer civic health outcomes, but that's actually also affecting the quality of people's physical health. So really interesting to start looking at those intersections between civic health and public health. So I think we've covered the local guide, so I'll go past that. But I wanted to just leave us today with some questions to consider at the summit. And one question is, what value could measuring civic health bring to your work and to your local community? Another question is, how could you support civic health measurement in Florida? And the last is how could you connect civic health data to civic action? So I think there might still be a bit of time for questions. I'm not sure. Hopefully someone's keeping time. But this is me. I'm Quixada Vissing. I'm on LinkedIn. My organization is called Public Engagement Partners with an S, so you can find me online. And it's just been my pleasure to speak with you today. I'm really excited to see how the conference unfolds, and thank you so much for having me here. So I don't know, do we just sort of open it up for questions generally? Yeah? I don't know if anyone has any questions or comments. Yeah, please.
Oh, thank you. I feel so official. Okay. Do you think that, in Florida it poses perhaps more unique barriers to civic health just because it is quite a large and not a very homogeneous state? And if so, because a lot of the examples that you've shown were quite small and were New England states, how do you think that we can approach it in the state of Florida?
Yeah, I really appreciate that question, and you're right. New Hampshire is a much smaller state than Florida, so maybe not the best comparison. One thing that we did in New Hampshire to supplement the census data was to do our own polling through a university center to try to understand more nuance of different regions in the state. So, universities know how to structure surveys in a way that are representative and things like that. So, that would be one suggestion I would have, is because Florida is a bigger state, because, the regions of Florida are just so different, that you might want to try to identify some different geographic areas or regions that you want to study, and then do some deeper survey research around that alongside the census data, which is incredibly helpful as well. So that might be a way to address that. Yeah, the local civic health guide would be another way, right? Maybe not as scientific, but you could certainly empower local people to do data collection around civic health in their local communities and have those conversations. So I think we're hoping that the state index is a catalyst for doing some of that local work. And Bob might have more to say. Yeah.
So The, so, yeah, okay. So the Civic Health Index that was done in 2008 and then 2009 and 2011 actually created the Sandra Day O'Connor Civic Education Act, which was a leading state legislature adopted this Sandra Day O'Connor. So that really was direct consequence of the Civic Health Index that were done, the two indexes that were done, and that was passed, I think, in 2010 or 2011. But so there is a way, even in a complex state, to advance in certain areas really direct action. So they have middle school and high school have all civics courses, and even in college, you have to demonstrate through a test that you are civically smart. But anyway, that is a success story in Florida that emerged out of the Civic Health Index and produced action at a state law that was then incorporated in the Sandra Day O'Connor Act.
That's great. Thank you for that example. Looks like there's another question. Oh.
Okay, so sorry. Hi. I had a question more so on, like, I think advice towards promoting civic infrastructure in local universities. I know that I attend a public university at in Florida, and with a lot of these restrictions that we're seeing on DEI and inclusion and equity, I was wondering, how might we promote civic infrastructure in a place that maybe does not want to facilitate civic health as much as maybe other states might?
Yeah, I mean, it's a really difficult question, and I feel for what's going on policy-wise in Florida. I know that's been some recent news, and I won't pretend that it's not hard, you know. That being said, you know, there might be a easier way to ease into that, which is I think even across partisan lines, there are some outcomes around civic health that Republicans and Democrats do both agree are good. Volunteerism, for instance, voting, you know, generally people are supportive of these ideas, at least in concept, right? So, you know, there might be some ways to start to build civic infrastructure around some of those like lower hanging fruits. I think, you know, I'm sort of curious to like open us up to that question up to others in the group, and maybe that's a good conversation for World Cafe or something later. But I think also, you know, I would still try to have those conversations, you know, even despite the fact that it might be out of sync with legislation, and just try to take some brave steps. I mean, you know, because I do think that you can't have strong civic infrastructure without making all people feel welcome in a community. It's just not possible. Yeah.
I'm not making a statement, so. So Pat Morris, I have the pleasure to work with Jim Murley down in Miami-Dade County for our first woman mayor, Danielle Levine-Cava. My question is, you know, I hear a lot of politicians in my job talk, and they never talk about this, ever. They don't ever bring it up. Why? Like, we need to prompt them, I think, more to start talking about this. Do you see that happening in Connecticut, in New Hampshire, maybe what you're doing in Seattle? Are local elected at the state level and, you know, the federal level, are they talking about this in those states? Because I mean, Miami-Dade County, the mayor is the only one that's talking about this. I don't hear anybody on the Democratic side or the Republican side talking about this, and I think they should.
Yeah, thanks. I appreciate that so much. And I'd love to see more of it as well. I would say, you know, and I'd be curious what my civic engagement colleagues think about this, but I would say that civic health is still sort of an emergent concept. So I think that, you know, in some ways it's becoming more, like even the fact that this conference is happening with a focus on civic health, I don't know that I would have seen this happening, you know, 5 years ago. So I do think that there's a learning curve where there's more and more discourse about it. That being said, it's certainly not a super well known about concept. The nice thing about civic health is that it's very, in a way, it's very concrete because it's about measures, right? And I think that people tend to like measurement, right? Because it's something that they can put their hands on. So, I hope that more of these conversations can happen at the government level. That's part of the work that I do. A lot of work that I do is with local governments or police to try to help them understand these ideas and build more practice into the ways that they work. But I agree that there is a little bit of a gap there in terms of understanding. And so, again, I think that's a really good, meaty question to dig into over the course of this conference is how could we, mainstream the concept of civic health and make it something more that everyone is talking about and understands. Yeah, thank you. And I will say, I don't have a clock, so just hook me off the stage when it's time. Last one, okay.
This was great, thank you very much. Danny Albertus, Quantum Foundation in West Palm Beach, Florida. I do a lot of interesting work nationally with Hispanics and philanthropy around the Hispanic and Latino population and the strength of what the GDP is right now and what it's going to be in the next 20, 30 years. South Florida, and maybe Pat Morris will talk more about what they're doing in Miami, is really interesting in the amount of new people coming in, both from domestically from the New York crowd coming in, and the buy-in just isn't locally, right? They're always complaining about something else, and they're not true Floridians in many ways, so they're not civically engaged. And then my question is really to the approach of, is there anyone at the national level doing anything with the Hispanic Latino population in making this something just commonplace for them? Because in South America, it is not existent at all, to be honest. And I'm curious to see what resources are out there or tools are out there for us to engage those communities here in Florida.
So is the question, are there civic engagement initiatives particularly focused on the Latino population?
How are your tools being woven in to include the Latino, Hispanic population, language-wise, cultural-wise, that way?
Yeah, I really appreciate the question. I think, so I think part of the Bella tool that I mentioned, the more qualitative tool, is that I think that when you're doing this sort of qualitative analysis in different communities, that you would hone in on the populations that you want to learn more about. So, obviously, if we were doing civic health in Alaska, it would be really different than if we were doing it in Florida. Different populations that sort of need attention around civic health. So I think that's one thought around doing this work in Florida is do we have sub-focuses where we really focus in on the Latino experience? I think on a broader level, I don't actually know of different organizations that are really focusing specifically on that intersection, and so if others do, I'd really like to know that. But I think it looks like someone does potentially. Yeah, please.
Hey y'all, I work here at the foundation. My name's Joshua Bean. Just real quick, two groups that I think of that come to mind, and we're partnering with them. One, we just had an event for Mi Gente, Mi Pueblo, which is an affinity space for Latinx, Latina populations. And we also have the Ariba Conference, which is the Pinellas Hispanic Chamber of Commerce. So just two groups that come off as I'm listening, and might be good to get feedback from them if that's a focus point moving forward.
Yeah, and I wonder if even reaching out to those local groups and starting a conversation, around what are the resources in the state. I think you were asking more for some resources at the national level, and that's where, I would imagine that there are organizations working at that intersection, but none come to mind for me. Absolutely, yeah. Yeah, well, I appreciate the question. I wish I. Yes, absolutely. I think that is a very easy step, right? To translate these materials. Yeah, that's something very tactile. Yeah. All right. Well, I think I've gotten the hook off the stage. So thank you so much. Really appreciate you.